when you came to me and talked about this project, I was very impressed that somebody has taken the initiative of doing something like this. And you have really some very good, strong ideas that have really worked with some of the people's thinkings, and because people don't talk about it enough. Now, marijuana is becoming more open now. It's not this crazy drug that people say is going to lead to other drugs like cocaine and marijuana leads to heroin. It does not. In most cases, it doesn't.
Right. It depends on the individual.
This is true. This
In
is
the
very
sense,
true.
if you do pills from a doctor, you could definitely go on to more pills if you feel that that's something that you want to do. Marijuana doesn't do it to you. It's what you feel in your mind.
That's true. That's very true. And with your project coming across with this, I was impressed that you really did want to do this. And that's why I had no reservations about talking to you about it. Now, I'm the first one to tell you that I grew up in the 60s and 70s, late 60s, where marijuana was the cultural thing. People, I don't drink, but I did smoke at some time. I really don't do that much of it anymore now at this point in time, because of my work issues, and I have to be careful with that at this point.
Do you think it's because like the baby boomers are getting older now, and it's becoming more open in the sense that it's not a taboo like it was?
That could be possible, but
they're getting the
how many states now? Are 23 states or something?
I think it's about 39.
39
states?
states,
I think
really?
39 states.
That it's for municipal reasons and
for
recreational.
There's just a few for
Just
recreation.
a few. But Florida's coming up on the election. They're talking about passing it to make it legal. And there's a big time lawyer in this town who's very
Yes,
supportive
John
of it.
Morgan.
Yes.
That's the biggest advocator of medical marijuana.
And he put a lot of his own money in to try to get that passed to make it legal. So it could work very nicely. But again, I'm very involved in it because I see some of my patients who are suffering in pain, issues with fibromyalgia, cancer patients who are doing, not smoking it like the reefer that people, Reefer Madness, that was the name of the movie. When the 1930s, where it went wild, and it was, that put the big taboo on marijuana for years. They would allow drinking, and they had prohibition, so they opened it up, and before you knew it now, Reefer Madness was really the kickstart that made marijuana look the taboo number. But again, I'm involved more. I see some of my patients now, and I've become more interested with it. A lot of it because of you.
If we can recommend a dispensary that's in Longwood, would you recommend some of your patients to get it in the legal aspect of it?
If they're allowed to do it, I would be more than apt to say that they can, if that's going to help them. I'm not a big pill man. I think pills, if doctors are becoming more, with the new laws that have come out, it's become more restricted. They used to just write scripts for pills and say, okay, this is take this Oxycontin, take this Percocet, and they just went wild with it.
Right.
And it has detrimental effects to most people. They become very addictive.
The organs could get shut down at some point.
That's part of it, but the problem is if you start doing it, you start taking too much of it, it can kill you. It'll stop the heart.
Right.
So you have to be careful with things like that too.
Absolutely. So did some of your patients ever say, hey, I'm taking this for my pain, and or they're just being pretty quiet about it?
No, what happens when we see patients nowadays, we have to be very open with them, and we talk about their medications.
Okay.
And I will ask a lot of my patients that said, are you on any medicinal marijuana and that kind of thing, and the oils? And there's quite a few now that are. And I learned more from them than I did from any literature or books or anything at that point in time, because I found out that they can put it in their belly button and it soaks in. Under the tongue, they can do different things like that.
Right, doesn't necessarily have to smoke it.
Right.
That's another thing that the Holland Club wants to let people know. It's not just about smoking.
Well, I think it's a very, very good start, and I think we need people who are pioneers. I mean, you could be the Madame Curie.
Well, it's been a pleasure meeting you. John Michelson said that you would be the best in doing this, and he actually, I have to say, John, I want to thank you for all your emotional support on this.
You're welcome.
I'm not going to give you any support, John.
So-
Don't worry.
Anyway, what about your lovely wife? We would love to, if she could be a part of this.
That would be fine. She has a history of fibromyalgia, and she's a brilliant woman who is a nurse by trade, and she takes care of all our little dogs now. So she's retired from all that, but she's had a history of the fibromyalgia, which she could probably discuss. And it's very difficult when somebody like myself, and even spouses out there, which is something that they can learn from the Holland Club, where a person like myself, we become very frustrated because we can't help. We can't find the cure. Why to stop them from hurting? What can we do to make them a little bit better? And again,
Right.
as you said, the first thing most of these doctors is write the Percocets and the Tramadols and that kind of thing. But
Right.
many doctors are opening up now a little bit more with the idea.
Well,
of
with the new
medicine.
legislation and right now that actually just recently, I don't know if you're aware of this, ladies and gentlemen, but in Florida, it's been about a week and a half that John Morgan actually had Rick Scott say, yes, we can smoke. I mean, that's pretty pitiful since over a year and a half. That 71% of the people that voted for this couldn't even smoke.
That's interesting.
So I would like to introduce your lovely wife.
Sure. Would you like? I can get off here and. See, I feel like I'm on the Johnny Carson show.
Yeah.
Here's Ray.
And this is my lovely wife, Debbie.
Hello, everybody.
Okay.
Hi, Debbie.
I
So
sometimes
nice
think
to
that
see
she
you.
was on marijuana when she married me. So
So Debbie, let me ask you this: with medical marijuana, I mean, in the sense you have fibromyalgia, that
Yes, I
is a
do.
very painful. What is the benefits of actually taking marijuana in the sense? Is it alleviate pain or?
Well, what I have noticed when I did take it, of course, it's not legal yet in the state, but out of state where it is legal, and I have had a chance to do it, I have noticed that an incredible relief in nausea, pain, when you're depressed, it helps your mood.
Okay, so in other words, it makes you more like level and even instead
Yes, yeah. Actually, patients that really need certain medications, the medication always reacts differently. It
very true.
goes to the points where the patients need it. It doesn't make them dopey or high, or it actually makes them feel good in the places they need to feel good in.
and can I interject? When she's talking about using with pills, that when doctors keep giving different pills, some of them have interactions and have severity levels that cause all kind of other different problems that you're going to have. When with the marijuana oils and different things like that, you don't see a lot of the complications involved with some of the other pills. And believe me, people are taking pills. Everybody thinks that you just take pills for pain, but they're taking it for blood pressure, they're taking it for cholesterol, they're taking it for every other little option that you can imagine.
Right, maybe different strains could be administered for different types of ailments.
True.
Because there is, ladies and gentlemen, over 2,500 different strains of marijuana.
I never knew that.
Yeah, I actually,
Never?
I've learned that about it.
I heard rumor that Philip Morris has thousands and thousands of acres growing in Colombia, waiting for it to become purely legal, and they've already trademarked Panama Gold and Panama Red and Acapulco Gold and different things like that. For you people who've been around 100 years, you'll know what that means. But
I have heard that term, actually.
So, do you think that it helps you because it actually, like something with the neurons in your brain, that it actually, like it connects to the nerve endings? Because they say everything starts with your brain.
Oh, yeah. When I started in medicine at University of Florida, my first main thing was neurology, and I did a lot of studying on the brain, but now University of Florida is actually taking marijuana, and they're taking marijuana and they're studying patients that have seizures and finding out that it's really helping. If you don't have fibromyalgia, there's no way possible to know how you feel.
So the burning sensation, pain?
It is pain like you never felt before, everywhere. And even on the days when you think that you're not having a lot of pain, you get used to certain degrees of pain after a while. Okay? I've had like 4 surgeries on my feet.
Because of fibromyalgia?
No, for a different reason. Fibromyalgia is actually a secondary condition. It is amazing. They did the test on me, and what they did was they turned me around, and what they did was they pressed different areas on my back and just wherever. And where they pressed, I didn't know you can have such intense pain. Yeah. So I had a lot of it. And right away they prescribe medicine for you, you know. I mean, then you go down that road.
Right. Now, do you remember the name of the medicines that they just
Lyrica.
Lyrica.
A lot of people are taking Lyrica. They're taking...
Lyrica it has a lot of different symptoms.
They're taking... I don't like any of the symptoms that come with a lot of medications. That's why it took me years just to find the cocktail that I'm on right now to make me feel decent. And when you have a hysterectomy and you don't have your regular hormonal flow, it's worse.
So does the marijuana help that?
Yes,
sense?
Actually it does. Like I said before, if you have a condition, okay, if you have a diagnosis, and you truly have a diagnosis, medicine or whatever they give you, whatever works for you, is going to help you. If you're taking it for kicks, it's not going to work in the same way.
Right. Do you think certain types of marijuana is better than others? Like certain types, like...
I'm not that experienced, but I would like to be able to take something that actually would help the all-over effect.
And
I would be very open to that.
And in defense of that, I've had several patients who have fibromyalgia, and they all have the same exact symptoms that my wife is describing, and it's amazing. And for years, fibromyalgia it was like a boohoo. Nobody really believed it. It wasn't a non-existent.
It's in your head.
It was in your head. It's rheumatism and all those kind of things that went down. But as it's become more and more pronounced, and you see it predominantly in women. You really do. And if they just even get a taste of maybe what the Holland group is saying here at this point in time, maybe they may wake up to it. But it's really going to be educating a lot of the physicians. You know, physicians all think that they can heal everybody. First want to tell you.
And they don't pay attention to you. Some women go to doctors and they just think that they just want medication. Okay? That they're drug seekers. That they don't really have it, that it's in their heads. And believe you me, I've had a couple doctors in my lifetime that didn't treat me very nicely, and I just turned and walked right out of that office.
Right.
And
People
if they
do have
treat me
choices.
like
I didn't have their legs broken, people, don't worry.
Right.
And if they do me that way, imagine what they do with all of the women.
That's why I started the Holland Club. We want to show people that they do have different choices, that they don't just have to get pills thrown down their throat. Hi. Yes, well, thank you for visiting thehollandclub.com, and we're showing you different ways to administer marijuana and what it can help. We also want to let the entertainment industry know we are looking for entertainers and eventually doing a show. So if you want to sponsor a show or you're an entertainer, please visit our site, thehollandclub.com. That's thehollandclub.com. I want to thank my audience for watching this, and I want to thank the people that helped me, which is this gentleman that I'm speaking to, Ray, as well as Jerome Williams, that helped me build the website. It's been a painstaking thing to get this done, but we're here today. Thank you.
And we really appreciate everybody coming and going, so enjoy life and pay it forward to each other.
Yes, and tomorrow we're going to be at, it's going to be at Tree Leaf Healing Center, located in Longwood, Florida. I want to thank you. We're going to be speaking to Kelly Judkins
HollandClub.com
for her
tuning in to
dispensary
me today,
and
we
people
will tell
with
many
their
different stories from many different people about many different problems concerning cancer, seizures, and other ailments. If you have a story, please come to my website. We would like to, we're in Florida, so if you're in Central Florida, we definitely want to hear from you. TheHollandClub.com. Thank you.